बोल देगा ना साथ वालों कम से कम आधे लोग तो आ जाए, तो वही अटेंडेंस ऑफ क्लास में रिकॉर्ड होती है, उन पे पूछेगी आके कि कितनी कम अटेंडेंस थी क्लास में, क्योंकि पहले नहीं होती थी, अब तो सारी क्लासेस ले होती है एमसीए की। तो कौन से डिसऑर्डर्स आते हैं सोमेटाइजेशन डिसऑर्डर में? लास्ट टाइम क्या बताया गया था? दो के नाम ही बता दो। चलो एक का तो बता दो। क्वेश्चन के नाम ही आंसर है, मैं इतना हिंट दे रहा हूँ, वही तो बता दो। तो मैं बताता हूँ। बेसिकली इसमें सोमेटाइजेशन डिसऑर्डर आता है, कन्वर्जन डिसऑर्डर आता है, हाइपोकॉन्ड्रियासिस आता है, बॉडी डिस्मॉर्फिक डिसऑर्डर आता है, और पेन डिसऑर्डर आता है, और अनडिफिनेटेड सोमेटोफॉर्म डिसऑर्डर, और सोमेटोफॉर्म डिसऑर्डर नॉट अदरवाइज स्पेसिफाइड। IC10 और DSM-5 के थ्रू में से क्वेश्चन करते हैं। इसका मोस्टली होता है कि वन और मोर सोमैटिक सिम्टम्स दैट आर डिस्ट्रेसिंग और रिजल्टिंग इन अ सिग्निफिकेंट डिस्ट्रक्शन ऑफ डेली लाइफ, excessive thoughts, feeling, or behavior related to somatic symptoms or associated with health symptoms as manifested by the at least one of the following: disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high level of anxiety about health or symptoms, excessive time and energy devoted to these symptoms or health concerns. Although any one somatic symptom may not be continuously present, the state of being symptomatic is persistent, typically more than 6 months. Specify is with predominant pain. This specifies for individuals whose somatic symptoms predominantly involve pain. And a persistent course is characterized by severe symptoms marked with impairment and long duration, at least 6 months. Mild severity, it can be mild, only one of the symptoms specified in criteria B is fulfilled. Moderate, two or more symptoms specified in the criteria B are fulfilled. Lifetime prevalence in general population is around 0.2 to 0.22% in women and 0.2% in men. Women outnumber men 5 to 20 times. This 20 times more common in females. It's mostly associated with low education and low income groups. Begins between around the age of 30. At 4 pain symptoms to GIT symptoms, 1 sexual symptom, and 1 pseudo-neurological symptom. And cause is mostly idiopathic. There is no known cause of somatoform disorder. Psychosocial interpretation of symptoms to avoid obligation to express emotions to symbolize a feeling or belief. Mostly in a somatoform disorder, it is usually preceded by a stressful event, any dispute. Biological factors: genetic loading around 10 to 20% of the first degree female relatives, 20% concordance rate in monozygotic twins, and 10% dizygotic twins. Clinical features: mainly somatic complaints, long complicated medical histories, circumstantial, vague and inconsistent, disorganized. Patients frequently believe that they have been sickly most of the time of their life. Psychological distress and interpersonal problems are prominent. Anxiety and depression are the most prevalent psychiatric conditions. Suicide threats are common. सिम्टम्स एक सोमैटोफॉर्म में और एक डिप्रेसिव पेशेंट के आपको सिम्टम्स तकरीबन सेम लगेंगे. लो मूड, पेन की कंप्लेंट, तो इन दोनों सिमिलर करते हैं. सोमैटोफॉर्म में बेसिकली मोर देन 3 सिस्टम इन्वॉल्व है, हम तभी सोमैटोफॉर्म डिसऑर्डर बोलते हैं. एटलीस्ट 3 डिफरेंट बॉडी सिस्टम्स शुड बी इन्वॉल्व, लाइक CNS, CVS, respiratory, GIT. Patient may be perceived as independent, self-centered, hungry for admiration or praise, and manipulative. Major depressive disorder, personality disorder, substance-related disorder, generalized anxiety disorder, and phobia. Nausea, vomiting, difficulty swallowing, pain in the arms and legs, shortness of breath, unrelated to exertion, amnesia, complications of pregnancy and menstruation. Chronic unrelenting and relapsing disorder that rarely remits completely. Treatment: there should be a single identified physician as a primary caretaker. Individual and group psychotherapy. Listen to somatic complaints as emotional expressions rather than medical complaints. Frequent and regular scheduled physician examinations help to reassure the patient that the physicians are not abandoning them and they are taking their complaints seriously. Other psychotherapies may include insight-oriented psychotherapy, behavior psychotherapy, cognitive therapy, and hypnosis may be helpful. Conversion disorder. Symptoms or deficits that affect voluntary motor or sensory functions, which suggests another medical condition, but that is judged to be caused by psychological factors because the illness is preceded by conflicts or other stresses. The disturbance does not conform to current the concepts of anatomy, physiology of the CNS and peripheral nervous system. Not intentionally produced are not caused by substance use are not limited to pain or sexual symptoms. The gain is primarily psychological and not social, monetary, or legal. Women to men ratio is 2 to 10 to 1. Symptoms are more common on the left than on the right side of the body in the women. Prevalence in general population, 1/3 of general population mild symptoms, around 500 people in per 1 lakh people, and male to female ratio is 2:1. In children, higher predominance is in girls. Affected males often involved in occupational or military accidents. Onset at any time, most common in adolescents and young adults. It can be comorbid with medical and special neurological disorders, depressive disorders, anxiety disorders, and somatization disorders. It's common in type A personality disorders. According to the psychoanalytic theory, conversion disorder is caused by repression of unconscious intrapsychic conflict and conversion of anxiety into a physical symptom. Conflict is between an instinctual impulse and the prohibitions against its expression. In terms of condition learning theory, a conversion symptom can be seen as a piece of classically conditioned learned behavior. Symptoms of illness learned in the childhood are called forth as the means of coping with the otherwise impossible situation. अभी तक क्या समझ आया? कुछ तो क्या समझ आया? अभी तो कौन से 2 डिसऑर्डर मैंने बताए हैं और कौन सा बताया? सबसे पहले कौन सा बताया था? सोमेटाइजेशन डिसऑर्डर. तो दोनों में क्या डिफरेंस है? Any 2 differences? लास्ट तो पूछ रहा हूँ, ऑप्शन नहीं दे रहा. पढ़ दो आप. तुम तो बोलो यार. और उसमें एक फॉर्म सेट क्या थी सोमेटाइजेशन में? स्टडीज यहाँ पे क्या है? एडोलसेंट यंग एडल्ट. ये मोस्टली टीनेजर्स में ज़्यादा होता है कंवर्जन डिसऑर्डर, और सोमेटाइजेशन मिडिल एजेस में ज़्यादा होता है. आगे चलते हैं. हाइपोमेटाबॉलिज्म ऑफ द डोमिनेंट हेमिस्फीयर एंड हाइपरमेटाबॉलिज्म ऑफ द नॉन डोमिनेंट हेमिस्फीयर. Excessive cortical arousal that sets off negative feedback loops between the cerebral cortex and the brainstem reticular formation. Paralysis, blindness, mutism are the most common conversion disorder symptoms. Anesthesia, paresthesia, common especially on the extremities. Pseudo seizures may be present. Seizure और pseudo seizure में क्या फर्क होता है? 3-4 बेसिक पॉइंट्स आपको लोगों को बता देता हूँ, तो आपको आगे मेडिसिन में भी बताएंगे. सीजर जो होते हैं वो यूजली 2 to 5 मिनट्स इसको लास्ट करेगा. इसमें टंग बाइट होगी, क्रॉसिंग होगी, टर्निंग ऑफ क्लोथ होगी. सूडो सीजर में ऐसा कुछ नहीं होगा. सीजर में पेशेंट को हमेशा चोट लगेगी, सूडो सीजर में कभी नहीं लगेगी, क्योंकि पेशेंट को खुद पता होगी वो गिरने वाला, पहले अपना हाथ नीचे लगाएगा फिर वो गिरेगा. सूडो सीजर यूजली आधा घंटा तक लास्ट कर सकता है, आधे घंटे से 1 घंटे, कभी कभी इन रेयर केसेस 2-2 घंटे तक भी लास्ट कर सकता है. टॉनिक क्लॉटिंग मूवमेंट्स ऐसे ही होंगी, तो इसमें ना तो कोई स्ट्रेचिंग ऑफ पीस होगी, ना टर्निंग ऑफ क्लोज होगी, ना क्रॉसिंग होगी. सूडो सीजर मोस्टली डिसोसिएटिव पेशेंट्स में और कंवर्जन डिसऑर्डर के पेशेंट्स में देखी जाती है. Patients achieve a primary gain by keeping internal conflicts outside their awareness. Tangible advantages and benefits are a result of being sick. Love and indifference is as a patient's inappropriately cavalier attitude towards the serious symptoms. The onset of conversion disorder is usually acute, but a crescendo of symptomology may also occur. Approximately 95% of acute cases remit spontaneously, usually within 2 weeks in a hospitalized patient. Reoccurrence occurs in around one-fifth to one-fourth of the people within 1 year of the first episode. A good prognosis is heralded by acute onset, presence of clearly identifiable stressors at the time of onset, a short interval between the onset and the institution of the treatment, and above average intelligence. Paralysis, aphonia, blindness are associated with good prognosis, whereas tremors, seizures are the poor prognostic factors. Resolution of the conversion disorder symptom is usually spontaneous. Insight-oriented supportive or behavior therapy can be used. Hypochondriasis. हाइपोकॉन्ड्रियासिस में डिफरेंट सोमेटोफॉर्म और कन्वर्जन ये होता है कि हाइपोकॉन्ड्रियासिस में एक ही सिस्टम इन्वॉल्व होगा. पेशेंट को ऐसा लगेगा कि मुझे अब हार्ट अटैक आ रहा है, तो जो टेस्ट करवाता जाएगा, उसके सामने रिपोर्ट होगी, फिर भी बोलेगा नहीं मुझे तो हार्ट अटैक आ रहा है, मैं तो मरने वाला हूँ. Characterized by a general and non-delusional preoccupation with fears of having or the idea that one has a serious disease based on the person's misinterpretation of the bodily symptoms. 6 months ranges of 4 to 6% up to 15% in the general medical clinic population. Men and women are equally affected. Most commonly appears in the age group of 20 to 30 years. Low thresholds for and low tolerance of physical discomfort. Viewed as a request for admission to a sick role made by a person facing seemingly unsurmountable and unsolvable problems, a variant form of the other mental disorders among which depressive disorders and anxiety disorders can occur. Clinical features. Patient believes that they have a serious disease that yet has not been detected and they cannot be persuaded to the contrary. It can be called as a form of delusion. Delusion की definition होती है कि it's a fixed, false, firm belief. इसमें होता है कि पेशेंट को जो मर्जी टेस्ट दिखा दो, अगर आप उसका सब कुछ टेस्ट करा के दिखा दो कि सब कुछ नॉर्मल है, वो क्या करेगा, वो उसको मानेगा नहीं और दूसरे डॉक्टर के पास जाएगा, और अभी जाके वो सिर्फ टेस्ट सारे रिपीट करवाएगा, फिर भी नहीं मानेगा, क्योंकि उसे ऐसा लगता रहेगा कि मुझे सच में हार्ट अटैक आ रहा है. और मोस्ट कॉमनली सीरियस सिस्टम इन्वॉल्व होता है. सेकेंड कॉमन रेस्पिरेटरी इन्वॉल्व होता है इसमें. Often accompanied by symptoms of depression, anxiety, and commonly causes with a depressive or anxiety disorder. Course is episodic होता है. Good prognosis is associated with high socioeconomic status, treatment response, anxiety or depression, sudden onset of symptoms, the absence of personality disorder, and the absence of a related non-psychiatric medical condition. Patients usually with psychiatric treatment. Group psychotherapy often benefits such patients. Body dysmorphic syndrome, characterized by preoccupation with an image defect in appearance that causes clinically significant distress or impairment in important areas of functioning. Concern is excessive and bothersome. A poorly studied condition. Most common age of onset is between 15 to 30 years. Women are more affected than men. May involve serotonin, reflecting the displacement of sexual and emotional conflict onto a non-related body part. Defense mechanism of repression, dissociation, distortion, symbolization, projection. Most commonly, people think of facial flaws, particularly involving the nose. Ideas of friend lesion of reference, that other people are talking about my body. Either excessive mirror checking or avoidance of reflective surfaces. Attempts to hide presumed deformity with makeup or clothing. Usually begins in the adolescence. Usually has a long and undulating course with a few symptom-free intervals. It can be treated by giving clopidogrel and fluoxetine and augmentation with clomipramine, buspirone, lithium, methylphenidate or antipsychotics may improve the response. Pain disorder, characterized by the presence of focus on pain in one or more body sites, is sufficiently severe to come to clinical attention. Somatoform pain disorder, psychogenic pain disorder, idiopathic pain disorder, atypical pain disorder. Lifetime prevalence is approximately 12%. Chronic pain appears to be the most frequently associated with depressive disorders. Acute pain appears to be more commonly associated with anxiety disorders. May be symbolically expressing an inter-psychic conflict through the body. Pain behaviors are enforced when rewarded and are inhibited when ignored or punished. Intractable pain has been conceptualized as a means of manipulation, gaining advantage in interpersonal relationships, for example, to ensure the devotion of a family member or to stabilize a fragile marriage. Often they have a long history of medical and surgical care, completely preoccupied with their pain, and cite it as a source of all their misery. Major depressive disorder is present in about 25 to 50% of the cases, generally begins abruptly and increases in severity for a few weeks or months. Treatment approach must address rehabilitation. Antidepressants such as tricyclics and SSRIs are most effective pharmacological agents. Psychodynamic therapy can also be given. Undifferentiated somatoform disorder, characterized by one or more unexplained physical symptoms of at least 6 months duration, which are below the threshold for diagnosis of somatization disorder. मैंने आपको बताया ना 3 सिस्टम होने चाहिए कम से कम यहाँ पे, पर कभी कभी क्या होता है कि 1 या 2 सिस्टम इन्वॉल्व होते हैं, तो हम उसे अनडिफरेंशिएटेड सोमैटोफॉर्म में रखते हैं क्योंकि वो प्रॉपर क्राइटेरिया मीट नहीं करती जो सोमैटाइजेशन डिसऑर्डर का होना चाहिए. सिमिलर इसमें ऑटोनॉमिक नर्वस सिस्टम मोस्ट कॉमनली इन्वॉल्व होता है, फटीग और वीकनेस ऑफ द कॉमन कंप्लेंट and autonomic arousal disorder. Somatoform disorder not otherwise specified. A residual category for patients who have symptoms suggesting a somatoform disorder but do not meet a single criteria for the somatoform disorder. Pseudopsychosis is a false belief of being pregnant that is associated with objective signs of pregnancy, which may include abdominal enlargement, reduced menstrual flow, amenorrhea, subjective sensation of fetal movement, nausea, breast engorgement, secretions, and labor pains at the expected date of delivery. इतना कॉमन नहीं है ये, मैंने आज तक एक केस में देखा 2 साल में. तो कौन से डिसऑर्डर्स पढ़ाए हैं? और पेन में कितने टाइप्स थी? पेन आगे 4 टाइप्स थी ना. Idiopathic pain disorder, somatoform pain disorder, and psychogenic pain disorder, somatoform pain disorder, idiopathic pain disorder, and atypical pain disorder.